Hello, this is Angelia, and you are listening to or watching the podcast, Why You Do What You Do. The podcast that talks about human development and psychology to maybe help you figure out a little bit more about why you do what you do. And last time we were talking about Alzheimer's disease, or we'll call it AD instead of saying that out loud every time. And we're going to take back up on that. Researchers are developing tools for early diagnosis or prediction of AD. Neurocognitive screening tests can make a reliable initial distinction between patients experiencing cognitive changes related to normal aging and those in early stages of dementia. But you gotta get tested, and that's the problem with a lot of people. They're scared, that, oh my gosh, I'm gonna have it, and I don't want to get tested, I don't want to know. Well, it might not be it. It might be something easier to, take care of, so you should still get tested. In a study at the Mayo Clinic, 12% of older people diagnosed with mild cognitive impairment through a clinical dementia rating scale developed AD within 1 year, 40% in 4 years, and 80% within 6 years. So these tests are fairly accurate. In another study at the University of California, San Diego, performance on paper and pencil cognitive tests predicted which participants would develop AD within a year or two. So again, these tests are fairly accurate, so if you really want to know, get tested. Persons diagnosed with mild cognitive impairment may be tested again after several months to reveal any significant declines, because you might not have any. It might not be AD or dementia. You might just be having a rough time. The tests may be followed by brain imaging to measure changes in the size of structures associated with preliminary stages of the disease, primarily the hippocampus. And that's how we know my husband has brain damage from his stroke, is they did a brain scan and we saw the little part of his brain that's basically white, useless stuff now. Brain scans that can show atrophy and diminished rates of blood flow and energy consumption, or analysis of beta amyloid levels in cerebrospinal fluid. For the first time, researchers at the University of California, Los Angeles, have used a brain scanning technique combined with a chemical marker to actually see brain lesions indicative of AD in a living patient. Used to be the only way they'd know for sure is when you were gone, they would cut your brain open and have a look. But now, they don't have to do that, thank gosh. They can just, do this and see. Accurate diagnosis is important, not only for persons with AD, but for those with depression or reversible dementias, which are sometimes misdiagnosed as AD. So again, get tested so you know for sure what it is you got going on. Causes and risk factors. Alzheimer's disease is strongly heritable. So if grandma or grandpa or mom or dad had it, bad news for you. The concordance rate among identical twins is nearly 90%. Siblings and children of a person with AD have at least a 50% risk of having it by age 90. At least 4 alleles that increase production or reduce clearance of beta amyloid have been linked to AD. So there's a genetic component. And, if you know that ahead of time, you can start taking steps to stop that from happening as fast. An early onset form of the disease, which appears in middle age, is related to dominant genetic mutations on chromosomes 1, 14, and 21. ApoE4, a variant of a gene on chromosome 19, carried by about 30% of the U.S. population, is an important risk factor for the late onset type, which appears after age 65 and accounts for 95% of cases. So again, like I say, if you're worried about something, if you notice you feel like I'm losing it, go get checked out. It's better to know, and you can get some treatment. Healthy middle-aged people without apparent symptoms who have the ApoE4 gene have been found to have deficits in spatial attention and working memory, similar to those seen in AD. However, late-onset AD probably involves a complex interaction of many genes, possibly different in different people. So again, it's how they present and what your DNA is doing with it. Unknown environmental factors also may play a part. Again, if you're smoking or, abusing your body, drinking and things, injecting, it's probably going to be a lot worse for you. Thus, while genetic testing for the mutations on chromosomes 1, 14, and 21 is highly predictive of the relatively rare early onset form, the presence of the ApoE4 gene alone does not conclusively predict or diagnose late onset AD. So, just because you have that, it might be latent, it might not be active, and it might not do that to you. Still, it may be useful in combination with cognitive tests, brain scans, and clinical evidence of symptoms. So there'll probably be a lot of different ways they're going to want to test you. Diet, exercise, and other lifestyle factors also may play a part. So again, we all know, you're supposed to eat right, you're supposed to exercise, you're not supposed to be smoking and all that fun stuff. African Americans in Indiana are 2 to 3 times more likely to develop AD than genetically similar Nigerians. And that probably has a lot to do with our diet over here. Nigerians have lower risk factors for stroke, such as hypertension and high cholesterol, which often accompany AD. Education and cognitively stimulating activities are associated with reduced risk of AD. So again, get you one of them little word puzzle books like I have, or learn a new language like I'm studying Spanish, and keep the brain busy. Because, I learned after I had my stroke, stuff was not happening right, especially in the speech area. So I was like, I need to learn. I need to keep learning something to keep this brain working. And smoking with increased risk. Again, we all know this. Other possible risk factors under investigation include sleep apnea and head injuries earlier in life. Now, I had an early head injury. I don't have sleep apnea. I had a kind of a crazy nurse practitioner at one point said, "Do you snore?" And I was like, "Okay, we're sending you for sleep, so you gotta sleep." No, that's not what I said. Get a grip. Treatment and prevention. The outlook for people with AD is brighter than before. Although no cure has been found, early diagnosis and treatment can slow the progress of the disease and improve quality of life. And that's why it's important to find these things out as soon as you can. Because there are treatments, there are meds that can help you live a longer life. When we found out my mother-in-law has, dementia, and we started her on drugs because she was having paranoid delusions a couple of years ago that everybody was stealing from her, everybody was doing mean things to her, everybody was doing everything, basically. I mean, she was just mouthing off to everybody about all the mean stuff. And finally, her son was talking to the doctor about it, and he said, well, that's common in people with dementia. There's paranoid delusions, and we'll give her a med that should help that. And it did, thankfully, because I was about done with even talking to her because I got tired of being accused of stuff that, wasn't even a thing that was happening. So, cholinesterase inhibitors, such as donepezil, commercially known as Aricept, can slow or stabilize symptoms for at least 6 months to a year in 1/3 to 1/2 of patients. So again, it's worth it, to take something that's going to help you. But do not stop the underlying deterioration, because nothing can at this point in time. Now, maybe someday, and that's why they're doing research. But right now, nothing can stop it, but it can alleviate symptoms. And that's helpful to you and the people around you. Behavioral therapies can slow the deterioration in capabilities improve communication, and reduce disruptive behavior. Like I was talking about, disruptive behavior. Drugs can relieve agitation, lighten depression, and help patients sleep. Proper nourishment and fluid intake, together with exercise, physical therapy, and social interaction, may be helpful. And this is something we're going through with her right now. She's in rehab right now. According to her, everyone's mean to her. She wants everyone to do everything for her. And she asked me, "Oh, can you bring me my tweezer and pull my..." It's like, you have hands. You have a mirror. Nothing's wrong with your hands, you know. Why? You can do this for yourself, honey. In the early stages, memory training and memory aids may improve cognitive functioning. And it can, you know. So, again, don't be scared to have yourself checked out if you think you could possibly have AD. And you might just have a little something that they can just treat, you know. Researchers are investigating new ways to diagnose AD and to understanding the brain changes involved, and are developing new preventative and ease of symptoms treatments. Blood tests that measure levels of the amino acid homocysteine and of amyloid precursor proteins may predict or diagnose AD and other forms of dementia in the early stages. Again, early stages. The discovery of a brain enzyme believed to be responsible for formation of amyloid plaque may make it possible to block the enzyme's action and prevent or slow the disease. So, this is something that they're working on right now. So, you know, don't be afraid that this is just it. I'm getting old and this is going to happen. Because every day there's new information coming out, new treatments, new drugs. So, you know, it behooves you to go and get help if you need it. Studies of rats and mice suggest that small clumps of misfolded amyloid beta protein may trigger the changes involved in AD. Drugs could be developed that would block the formation of these clumps. One drug now being tested in humans shrank the amyloid plaques in mice. And this is why we have research. Don't come at me, PETA. I'm not advocating. I'm not doing it. So I'm just saying this is what's happening. So this is why they do this research. Because if it works in mice, it's possible that it can work in humans. So they're working on this drug now. And, you know, maybe someday AD will be a thing of the past. It'll be something treatable. Reversible conditions. Depression. Now, this is the number one killer in the world, and it is also the number one problem that most people have and suffer through that could be easily treated. Many older people and their families mistakenly believe that they can do nothing about mental and behavioral problems, even though close to 100 such conditions can be cured or alleviated. So, again, if you're worried about your mental health and you're scared, oh gosh, they're going to say I'm crazy and they put me, that's almost never a thing you get put in when you're a danger to yourself or others. If you're talking about killing yourself, killing other people, seriously, I mean, we all joke about it sometimes, but seriously, then that's when you go in somewhere. If you're just depressed or, you know, scattered or whatever, talk therapy usually will take care of that. Meds for the depression. So again, it's worth getting seen rather than suffering. Sometimes apparent dementia turns out to be a side effect of drug intoxication, because physicians do not always ask what other medications a patient is taking, and now mine all do, my husband's all do, all of them here do, so I don't know who's not doing their diligence there. They may prescribe drugs that interact harmfully, and I've heard of it happening. Also, because of age-related changes in the body's metabolism, a dosage that would be right for a 40-year-old may be an overdose for an 80-year-old. So that's something to take into consideration, any of you prescribers out there. And if you feel like your elder is being overprescribed, you can certainly bring that to their attention and say, hey, you know, I feel like this is affecting them really hard. Besides drug intoxication, Other common reversible conditions include delirium, metabolic or infectious disorders, malnutrition, anemia, low thyroid functioning, minor head injuries, alcoholism, and depression. Nearly 2 million older Americans, about 6%, are known to suffer from some form of depression, but the illness often goes unrecognized and untreated. So again, that's sad, and depression is very treatable nowadays. There's all kinds of different drugs on the market. There's therapies. So there's really no sense for anyone just to sit and suffer with depression. You're just hurting yourself. Contrary to popular belief, depression is diagnosed less often in late life, even though symptoms of depression are more common among older adults than among younger ones. Why is this so? Depression may be mistaken for dementia, or it may be wrongly seen as a natural accompaniment of oh my gosh, I'm choking here. Accompaniment of aging. And that's not necessarily true. All people who get older are not depressed that they're getting older. It's just, you move on because, let's face it, we're all going to get older. And it's not just natural to be depressed when you're old. It may be masked by physical illness. Or older people simply may be less likely to say they feel depressed, perhaps because of a belief that depression is a sign of weakness or that it will lift by itself. And I mean, we know, I've told my dad he was depressed at one point. My uncle told him at one point, because he was down and he wasn't eating and taking care of himself and all. And so we told him, we think you're depressed. And my uncle was wanting to talk to his doctor and everything. And, he ended up having a fall and going in anyway. And, I think they were giving him a little something at the rehab center because, he was like happy and laughing and joking, and so I was like, yeah, they're slipping him a little something because he seems to be much happier. One indication that depression is often overlooked in older adults is the high prevalence of suicide in this age group, and that's unfortunate. A lot of people think the teenagers are old folks are more likely as well. And again, that's because they feel like everything's hopeless. They're old. They can't do anything. They can't remember anything. And it's like, this is not true. There are treatments, and you can talk to your doctor, or your therapist or whatever. You don't have to suffer through this to the point where you feel like life is not worth living and you need to do something to end it. Since depression can speed physical declines of aging, accurate diagnosis, prevention, and treatment could help many older people live longer and remain more active. And that's kind of our goal, isn't it? We all want to live, to be old. The years of a man are 120 now, it says in the Bible. That would be cool to live to be 120. You just think about all the things that have changed since we were kids, Excuse me, I was born in 1967, so I grew up in the 1970s. We had the old rotary phone on the wall with the big long cord. We had the little black and white TVs to start out with. I think it was 9 when we got a color TV. So, a lot of things have changed over the years. Oh my, excuse me. They used to advertise cigarettes on TV back then. And alcohol. They can do that a little bit now with the alcohol, but not the cigs and stuff. So, things change. And it's just part of life. And there's no use in sitting there but moaning your situation that you're getting older or whatever. And if you think you're having a problem, talk to someone. Talk to your doctor, get some help, because a lot of these problems can be, fixed, if not, the symptoms eased. So, that's where I'm going to leave you for today. I hope that helped you figure out maybe a little bit more about why you do what you do. Please like and share this educational program so we can spread it around the world. If you want to help me out, subscribe to my YouTube channel. If you want to help me out even more, go to my Patreon page and become a patron. That's all for now. Until next time.